Diarrhea. Definition. Diarrhea is defined by the World Health Organization as having 3 or more loose or liquid stools per day, or as having more stools than is normal for that person. Acute diarrhea is defined as an abnormally frequent discharge of semisolid or fluid fecal matter from the bowel, lasting less than 14 days, by World Gastroenterology Organization. Diarrhea is a condition defined by an increased frequency of bowel movements, more than 3 per day, increased amount of stool, more than 200 g per day, and altered consistency, liquid stool. Classification. On the basis of duration. Acute diarrhea. The most common acute diarrhea is loose watery diarrhea that lasts 1 to 2 days. This type doesn't need treatment and it usually goes away after a few days. Persistent diarrhea. This type of diarrhea generally persists for several weeks, 2 to 4 weeks. Chronic diarrhea. Diarrhea that lasts for more than 4 weeks or comes and goes regularly over a long period of time is called chronic diarrhea. On the basis of clinical presentation. Acute watery diarrhea. Acute bloody diarrhea. On the basis of physiology. Secretory. Secretory diarrhea means that there is an increase in the active secretion, or there is an inhibition of absorption. There is little to no structural damage. The most common cause of this type of diarrhea is a cholera toxin that stimulates the secretion of anions, especially chloride ions, Cl. Therefore, to maintain a charged balance in the gastrointestinal tract, sodium, Na+, is carried with it, along with water. In this type of diarrhea, intestinal fluid secretion is isotonic with plasma even during fasting. It continues even when there is no oral food intake. Osmotic. Osmotic diarrhea occurs when too much water is drawn into the bowels. If a person drinks solutions with excessive sugar or excessive salt, these can draw water from the body into the bowel and cause osmotic diarrhea. Osmotic diarrhea can also result from maldigestion, e.g. pancreatic disease or coeliac disease, in which the nutrients are left in the lumen to pull in water. Or it can be caused by osmotic laxatives, which work to alleviate constipation by drawing water into the bowels. In healthy individuals, too much magnesium or vitamin C or undigested lactose can produce osmotic diarrhea and distension of the bowel. Exudative. Exudative diarrhea occurs with the presence of blood and pus in the stool. This occurs with inflammatory bowel diseases, such as Crohn's disease or ulcerative colitis, and other severe infections such as E. coli or other forms of food poisoning. Inflammatory. Inflammatory diarrhea occurs when there is damage to the mucosal lining or brush border, which leads to a passive loss of protein-rich fluids and a decreased ability to absorb these lost fluids. Features of all 3 of the other types of diarrhea can be found in this type of diarrhea. It can be caused by bacterial infections, viral infections, parasitic infections, or autoimmune problems such as inflammatory bowel diseases. It can also be caused by tuberculosis, colon cancer, and enteritis. Dysentery. If there is blood visible in the stools, it is also known as dysentery. The blood is a trace of an invasion of bowel tissue. Dysentery is a symptom of, among others, Shigella, Entamoeba histolytica, and Salmonella. Causes. Many cases of diarrhea are due to an infection in the gastrointestinal tract. The microbes responsible for this infection include bacteria, Salmonella, Campylobacter, Shigella, and Escherichia coli. Viruses, norovirus, rotavirus, adenovirus. Parasitic organisms, Entamoeba histolytica. Some other major causes of chronic diarrhea include microscopic colitis. This is a persistent type of diarrhea that usually affects older adults. It develops due to inflammation and occurs often during the night. Malabsorptive and maldigestive diarrhea. The first is due to impaired nutrient absorption, and the second is due to impaired digestive function. Celiac disease is one example. Chronic infections. A history of travel or antibiotic use can be clues in chronic diarrhea. Various bacteria and parasites can also be the cause. Drug-induced diarrhea. Laxatives and other drugs, including antibiotics, can trigger diarrhea. Endocrine-related causes. Sometimes, hormonal factors cause diarrhea. This is the case in Addison's disease and carcinoid tumors. Cancer-related causes. Neoplastic diarrhea is associated with a number of gut cancers. Irritable bowel syndrome, IBS, is the most common cause of functional diarrhea. In functional diarrhea, all the digestive organs appear normal. They are not functioning as they ideally should. IBS causes many symptoms, including cramping, abdominal pain, and altered bowel habits, which can include diarrhea, constipation, or both. Inflammatory bowel disease, IBD, is another cause of chronic diarrhea. IBD describes either ulcerative colitis or Crohn's disease. Both conditions can also cause blood in the stool. Sign and symptoms. Diarrhea refers to watery stools, but it may be accompanied by other symptoms. These include stomach pain, abdominal cramps, bloating, weight loss, fever, body aches, chills. Diarrhea is also a symptom of other conditions, some of which can be serious. Other possible symptoms are blood or pus in the stool, persistent vomiting, dehydration. If any of these accompany diarrhea, or if the diarrhea is chronic, it may indicate a more serious illness. Diagnostic evaluation. History taking. Current medications. Past medical history. Family history. Travel history. Any other medical conditions. Also ask when the diarrhea started. How frequent the stools are. If blood is present in the stool. If the person has been vomiting. Whether the stools are watery or contain mucus or pus. How much stool there is. Physical examination. They will also look for signs of fever or dehydration. Stools with blood or pus. Severe pain. Low blood pressure. A full blood count. Anemia may suggest malnutrition, bleeding ulcerations, or IBD. Liver function tests. These will include testing albumin levels. Tests for malabsorption. These will check the absorption of calcium, vitamin B12 and folate. They will also assess iron status and thyroid function. Erythrocyte sedimentation rate and C-reactive protein, RESD levels may indicate IBD. Tests for antibodies. These may detect celiac disease. Stool tests. Doctors can identify parasites, bacteria, and a few viruses in stool cultures. Stool tests can also reveal microscopic blood, white blood cells, and other clues for diagnosis. Colonoscopy, to visualize the digestive organs for infection, inflammation, tumors, and cysts. CT/MRI scan, to visualize the digestive tract and accessory organs of it, e.g. liver, pancreas for any abnormalities. Medical management. Rehydration. Children and older people are particularly vulnerable to dehydration. For all cases of diarrhea, rehydration is vital. People can replace fluids by simply drinking more of them. In severe cases, however, a person may need intravenous fluids. Oral rehydration solution or salts, ORS, refers to water that contains salt and glucose. The small intestine absorbs the solution to replace the water and electrolytes lost in the stool. In developing countries, ORS costs just a few cents. Zinc supplementation may also reduce the severity and duration of diarrhea in children. Antidiarrheal medication. Certain medications, antidiarrheals, e.g., loperamide, imodium, diphenoxylate, Lomotil, may reduce the severity of diarrhea and the disease. Antibiotics. Antibiotics can only treat diarrhea due to bacterial infections, e.g. metronidazole, ofloxacin plus ornidazole, norfloxacin plus tinidazole, ciprofloxacin plus tinidazole. Diet. The following diet tips may help with diarrhea. Sipping on clear liquids, such as electrolyte drinks, water, or fruit juice without added sugar. After each loose stool, replacing lost fluids with at least 1 cup of liquid. Doing most of the drinking between, not during, meals. Consuming high potassium foods and liquids, such as diluted fruit juices, potatoes without the skin, and bananas. Consuming high sodium foods and liquids, such as broths, soups, sports drinks, and salted crackers. Eating foods high in soluble fiber, such as banana, oatmeal, and rice, as these help thicken the stool. Limiting foods that may make diarrhea worse, such as creamy, fried, high dairy, and sugary foods. Foods and beverages that might make diarrhea worse include sugar-free gum, mints, sweet cherries, and prunes. Caffeinated drinks and medications. Fructose in high amounts, from fruit juices, grapes, honey, dates, nuts, figs, soft drinks, and prunes. Lactose in dairy products. Magnesium. Olestra, olein, which is a fat substitute. Anything that contains artificial sweeteners. Probiotics. There is mixed evidence for the role of probiotics in diarrhea. They may help prevent traveler's diarrhea, and in children, there is evidence to suggest that they might reduce diarrheal illness by 1 day. Probiotics come in capsules, tablets, powders, and liquids. Nursing management. 1 fluid volume deficit (RT) excessive defecation. Goal. Fluid volume deficit is expected to be resolved. Interventions. Assess vital signs. Observation of excessive dry skin and mucous membranes, decreased skin turgor. Measure body weight each day. Collaboration intravenous fluids. Rationale. To determine the general condition of the patient. Showed excessive fluid loss, dehydration. Indications of fluid and nutritional status. Maximizing fluid in dehydration. To imbalance nutrition less than body requirements (RT) inadequate intake. Goal. Patient's nutritional needs can be met. Interventions. Auscultation of bowel sounds. Encourage rest before eating. Measure body weight each day. Feed little and often frequency. Rationale. Intestinal irritation may accompany intestinal hyperactivity, decreased water absorption and diarrhea. Peristaltic soothe and improve the taste of food. Providing information about dietary needs and the effectiveness of therapy. To stimulate appetite. 3 hyperthermia (RT) the set point increases, disease process. Goal. The body temperature of the patient can return to normal. Interventions. Assess vital signs, body temperature, especially. Give warm compresses. Collaboration of antipyretic drugs. Rationale. To determine the body temperature. For solidity causing blood vessels, resulting in evaporation which can reduce the heat. Help the healing process. Complications. 2 potentially serious complications of diarrhea. Dehydration, in cases of severe and frequent diarrhea, and malabsorption, in cases of chronic diarrhea.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.